My first MDT, I was absolutely terrified. I looked young and my role was new. I had severe imposter syndrome and was intimidated by doctors. I sat on a chair with my bag and coat on and didn't say anything. I didn't understand any of the jargon I heard, but I was excited to learn. The MDT weren't hostile, but did not understand my prior clinical experience and questioned my decisions. I feel a much greater sense of belonging now. I have built up trust, my clinical reasoning is heard and accepted, and I am supported by all members of the MDT, senior and junior. However, I still feel very much a black sheep in my own profession. I have enhanced my skills, I work autonomously with a very wide scope. I think I'm the only one managing our patients in this way. I am met with the distrust and skepticism I was met with initially in the MDT, but I feel the attitude towards me is not growing and shifting as it did. It impacts me greatly. Feeling like I don't quite belong in two worlds is difficult for me personally and professionally. I feel frequently disheartened by my lack of belonging. I've struggled to build and maintain momentum in growing my career and networking because of it. I would like to feel appreciated and my experience heard amongst my colleagues. Whenever I try to encourage colleagues to be more engaged and active, as the environment demands, I am met with a bit of a telling off, as they are always my senior. I would like these colleagues to be open-minded and see in me the possibilities for more seamless care. I feel my sense of belonging shatter when I hear, "That's not how we do things. No, that's not your job." The NHS have a lot of opportunity for professional development and growth, and this has been a big contributor to my feeling of belonging as a whole. I know my role will be recognised, specialist area of our work one day.
I felt nervous at my first team meeting. I can't recall where I sat, but it would have been on the periphery. I don't recall if I spoke or what about. If I did, it would have just been hello to introduce myself. I remember the team being very cold and standoffish. Nobody really came up and said hello other than management. I'm still somewhat junior in our team nowadays, but I'm a lot more involved in discussions and have a prominent role in delivery of an online service. I get frustrated by others in the team, particularly those who are deemed senior. At times, there seems to be a severe lack of effort, care, or willingness to work to what I would consider a high standard. Many in the team do the absolute minimum and are often late and are sloppy. We had a recent MDT meeting and nothing changed. Those who managers considered hard work due to the issues above were allowed to carry on as normal. The MDT is very much us and them. Despite working across specialities, there is very little co-production.
My first MDT, I was quiet, anxious, reserved. I felt isolated and not as knowledgeable as my peers. I sat in a corner and did not want to be in front of everyone because it felt intimidating. I felt unsupported and felt pushed into the deep end. I talked but told too much at once. I recall telling everyone I'd never attended an MDT before. The team responded fine and I eventually relaxed. I have given good information. The consultant was quite impressed, so it felt rewarding to be part of the group. MDT meetings are important to move the patient's therapies forward, set plans and goals, and find out more information from specialists. My sense of belonging makes me feel relevant and helps me absorb more information and communication. I feel a little less anxious, but worry if there are questions I am unable to answer in front of everyone, which will make me feel inadequate. I'm listening intently and writing things down to help me remember, as I'm worried I may feel overwhelmed and overloaded by too much information. I guess I feel I should know everything. To help with a sense of belonging, I would let staff have exposure to MDT, let them listen and observe how teams think, and feel more before being pushed into the unknown and causing undue anxiety and distress. I would like others to ensure that my profession is present as we spend the most time with the patients. Sometimes the MDT still goes ahead without my input. I have asked for protected time to attend, but this doesn't happen. Being over-talked and unable to complete your question or concern impairs a sense of belonging. Strong characters can also impair a sense of belonging. Listening from others and feeling valued for your opinions creates a sense of belonging.
Initially, I was nervous and felt very junior and was reluctant to speak. I sat next to a familiar face. The rest of the team were neither welcoming nor not. As time has gone on, the senior staff accept you into the team more. However, the hierarchy is still present. I was recently cut down in a meeting when I was trying to speak by a senior member of the team and my views were totally ignored. This was done in a belittling manner, even though my point was valid and I was trying to help. My views are often not listened to. I am not in the inner circle, so I am given less time to speak. An example of differences in how people are treated in the MDT is that doctors often don't adhere to policies and nurses are expected to police this. I would change the system to see parity amongst all MDT members, giving each a chance to chair meetings and have an equal say. I would also like to see more welcoming attitudes to new people in the meeting. I once tried to invite hotel services staff to the morning meetings to make them feel included. Their managers didn't seem to want to change and only came to one meeting. I believe culture in the NHS is hard to change. Cliques, hierarchy and customs can all impair a sense of belonging.
My first MDT was a bit nerve-wracking. There were a lot of unfamiliar faces, and they didn't introduce themselves. They talked so fast, I had to ask them to slow down. And some responded okay, but some just carried on, so I had to ask somebody else what they'd said once the meeting had finished. Different people ask me things or say I will know something, but that's not always the case. My colleagues sometimes tell me people have been looking for me, wanted me for something, but I still don't feel like I fit in. Some managers will say, I don't know anything, or I don't do anything, and that gets me down. I try to laugh it off, but it always stays with me. They say it's a joke, but I don't see it like that. They don't do it to other people. There's a sense, if you agree with everyone, you belong. If you disagree, for whatever reason, you're an outcast. I just wish everyone would treat each other the same.
Thinking back to when I first started here, I was invited to introduce myself and meet the team. Knowing I would be seen on the huge screen in the MDT room felt a bit overwhelming, but I also felt excited at the same time. Everyone introduced themselves and their roles and said how long they'd been on the team. In the meetings, we have quite a few consultants, quite a few nurses, 2 AHPs, and me. With new referrals, by the time everyone has set their expectations, it's difficult to put my case forward. AHPs will both back one another. Nurses might say the referral is outside their role, so here I am. I feel that saying no can be difficult. I have to be quite firm not to land up with all the referrals. In general, I feel that I belong in the team. I get quite a lot of respect. Team members recognise my skills and knowledge and often rely on my expertise. There's also a lot of support and general care and kindness to one another. We work as a great team when it comes to the care element. However, when everyone is under pressure, I do feel alone, singled out at times. It can be difficult to have my voice heard. I feel I always need to push harder, be repetitive, then I am heard. I'm the only one from my profession in the team. I have no one to back me up, to look at the same issues and challenges the same way that I do. Maybe we need to rethink how we run our MDT meetings. It's usually a consultant taking the lead. The majority of the discussion is within the medical profession. I also feel that we need to do more on the personal level. Maybe spend more time during breaks getting to know each other, finding time to do wellbeing walks, team bonding sessions. Respect creates belonging, respecting people's views, values and differences. Being open, finding time to listen actively, not disregarding people. We're all guilty of rushing. Time pressures often affect our communication skills. Poor communication impairs belonging.
It's so surprising how we can feel disrespected when we have no ability to talk, to present our argument, our ideas. It makes you feel worthless, not important, not part of the team. Doing this questionnaire made me question my place in the MDT, but also in the profession, as my location isolates me from the wider service, and I can feel detached, out of the loop.